MEC, thank you very much for your time this Sunday morning. So the current taxi violence certainly has a very significant impact. Increased trauma admissions from shootings, health workers not getting to work, vaccination rollout compromised, people forced to congregate at taxi ranks waiting for transport. Are you expecting to see a significant spike in cases as a result?
Yes, indeed, of course. When there are gatherings, it is bound that there will be a high level of transmission. But it's still early to say in terms of where things are right now, because usually you get about a week or so, especially when people now have to come for the testing. Also similar with when people also get infected, even the hospitalization doesn't normally come immediately. You get about 5 days to about 10 days after the person has been infected. But as I indicated earlier, that when there are gatherings, there will always be some elements of the transmission. But also you need also to understand that the gatherings that are happening outside vis-a-vis the gatherings that are happening inside, when there are no poor ventilation, they're still going to have an impact, but differently in regard to that space. But again, and I must also indicate that even before we talk about the gatherings, we must understand that when there are civil unrest, it does have a huge impact on the delivery of the services. Even prior we had these gatherings, the actual shooting did have an impact on our services in regard to the trauma cases that we see, plus also in regard to the forensic investigations that needs to be done. I'm talking about the postmortems, because they are unnatural death when you have got the gunshot. And the team from the trauma, they normally, especially from the surgeons, they normally talk about how it becomes quite complex to manage. I'm talking now in the operations in theaters, when you have the multiple gunshot person in this instance. So it's not only about now that there's been disruptions, because when there were shootings, for example, at Fortescue, we had about 18 cases of the gunshots, which was quite abnormally higher during the time. And noting, currently we're on lockdown level 4 restrictions, and also there's alcohol ban, meaning at least there have been a drop in regard to the trauma. But now we've seen in the past week when we had the gatherings, where we had about, and also there was some unrest, about 9% increase in our trauma cases.
We're expecting the President to speak to us this evening, possible relaxation of restrictions on the cards. How do you feel about that in the Western Cape, given that you're already seeing these increased trauma cases amidst this ongoing taxi violence? If the alcohol ban is eased, alcohol is available again, do you think that's going to exacerbate the situation in the Western Cape?
COVID or no COVID, alcohol will always have an impact on the health system. It has always been the case, even prior COVID, when we, especially during the end of the month, over the weekends, the 2 a.m., where you will see quite a high level of the traumas. And then you add the existing crime that used to be there, whether it's through gang and all other facts. It used to have a huge impact. Now you add trauma that we used to have as a result of the alcohol, plus also the COVID. So the issue is about when you have the same staff, we have to manage both kind of these, and then we are at the same time that we have to prevent COVID, because we need more staff. So generally in the health system always will have an impact, probably even from the social development aspect in terms of the dysfunctional families, but generally that's how things are. But talking about the COVID, where we are now, our cases are plateauing. We don't know exactly whether it could be because of the lockdown restrictions. And as you know, as I indicated earlier, that so often you get these, it's about 7 days moving average. So it might still be far early to tell now the impact of the gatherings in regard to our numbers, because the data integrity, it gets affected when we have got the issues of the unrest. But where we are now, while still in third wave, we don't know whether the plateauing, it's about we have reached our peak, because the modelers talk about mid-July to early August. We might have reached our peak. In as much as that our positivity rate is high, but because we didn't test much, it becomes difficult to know exactly the way we are going at. But generally, you cannot talk to any health person and ask about how will the person feel about banning or unbanning of the alcohol. Because for us, whether there's COVID or not, it will always have a huge impact negatively.
MEC, it's absolutely imperative to ongoing efforts of the broader healthcare sector that this taxi violence is dealt with and dealt with soon. Do you think the Transport Department is doing enough to quell the current taxi violence?
There is a history about the taxi violence. Fortunately, in as much as that I'm in the health space, I'm become part of the cabinet, knowing what is actually happening. Also taking note that it's not only about the issue of the transport, and I'm talking now about the health in regard to us, where we have seen some other staff members being unable to come to work. Not necessarily some of them are using the public transport, but also if you don't want to be caught up in a situation of the flying bullets and all of those. And thanks to those staff and those health facilities, where they even manage to make some of the plan Bs, for example, creating a ward where for the shift for those who will be unable to be able to go home, so that they can be able to use that open ward. And I'm aware that in other facilities where there are hospital boards, they manage to assist the staff in regard to their B&B. But also now the issue that the question that you have raised. It's about, for us, of the lessons learned, not only during the COVID itself, but always for us, we reach out to our audiences. There was the issue of the negotiations and also the issue of talking to the actual people who are getting affected, for example, the commuters. Well, some of the commuters who are also our patients or our clients have been unable even to come and fetch their medicines because of that. So that's why for us, every a social ill or every unrest, whatever is happening in the community, gets absorbed by health. That's why we always step up and see how we can be able to assist the other sectors, because it will have huge impact on us. Even with the economy, where even in those areas where the ranks will be closed, there are people there who are informal traders who will get impacted in regard to the economy, which is we do know when we have got no means, it means that you will rely on the public services, which is us. So that's why we urge and plead to those affected, they need to expedite this conversation. Again, we appeal for safe passage for healthcare workers. Especially when we are wearing uniform.
Unfortunately, we have run over our allowed time for this interview. I really do appreciate your time and for speaking to us this morning on the health situation in the Western Cape. MEC Noma French Mbombo speaking to us.